Smile for the camera. Welcome to Neckline Placement 101. Okay, the patient's been prepped already. We have gloves on, we have no rings, we have no watch. And we can all look at our landmarks. We can already see the landmarks here. This is the sternal knot. You put your finger in the sternal knot and you actually take out the muscle bellies are looking at it. The muscle bellies are the sternocleidomastoid, the sternal muscle belly, and the clavicular head. It comes with a triangle right there. So without even touching the patient's neck, we actually can see the muscle bellies here. So we don't need to do any massaging of the patient's neck. The kit is already set up the way you want it, so we don't need to actually set the kit up at all. Just go ahead and open the kit and grab our finer needle. We need to do the finer needle first. Once again, muscle bellies, the only thing I do is I put my fingers there for a minute, just make sure the carotid pulse is not underneath my fingers. And then we're going to actually insert the needle just at the apex of the triangle, and the vein should go from the foramen lacerum in the underneath the ear to the underneath the jugular notch in the clavicle. So the vein should be just medial and underneath the clavicular head of the sternocleidomastoid. And we're going to insert it at the apex. Without aspirating, we're going to insert down, and there it is. It's important not to make the mistake of trying to aspirate too hard of the tissues, because then the vein collapses as you go in. So we're going to insert again without aspirating, and there it is. We're going to throw the wire quickly. It should go easily. Once we see the 3 marks at 30 centimeters, the wires, and we're also going to look at the EKG at the same time to make sure there's no dysrhythmia in the wire. All the sharps should go back into the sharps holder in your kit. And once again, the kit's just the way it was packaged. We didn't actually change the kit at all. And we're going to check to make sure that we're in the right vessel. You always check, even though it looks obvious. You put an angiocath over the wire. And just make sure it's not pulsatile. So that's obviously vein, and venous blood is coming back slowly in the catheter. Now we're going to do some quick setup here. We're just going to take the stylet and put it into the catheter in the back. So it goes all the way into the catheter. We're going to take the tag off, and we're going to make sure we close the port here so it doesn't bleed back. This is a safety knife, so it's out now. The blade should be either inferior or lateral, so it goes away from the carotid artery. And you make sure that you don't get the EJ. Make sure that you're also in the same hole with the wire. So the wire, here's the wire here. It should not have a skin tag. It should go back and forth easily, which it does. You're just going to make sure the wire comes out of the top of it. And you're going to feel 2 pops. The first pop is the platysma. Second pop is the vein. Once you feel 2 pops, then you can pull the wire and stylet out of the catheter as you thread the catheter into the patient. show you the fastest way to sew it in. You want to have the largest port away from the patient so that it's more comfortable for the patient when he wakes up. You get a good bite of dermis. And we're not going to cut it yet, we're going to go ahead and sew the other side. Just saves time. And now we're going to sew the tail to the suture that we just put through. I'm going to do it one more time because, of course, I forgot to do the actual line itself. Take our safety knife again. The blade is out. Long we're going to use it. Put all the sharps back in the sharp hole. So we didn't make the typical mistake. The two mistakes that you can make are you aspirate harder than you can get the line in, and also the vein is usually in the first half of the needle. It's not very deep. So when we're aspirating harder, usually we're not get the line fully. Foot catheter. This is actually the CVP catheter.